Welcome to the Talking Transformation podcast, presented to you from the Western Cape pod bunker located here in the heart of Cape Town, South Africa. This pod is presented to provide a platform and a voice for built environment professionals and interest groups who are working towards transforming the places and spaces here in South Africa. It is dedicated to those individuals and community groups that are supporting both the formal and informal processes that are shaping our cities and our spaces. In recent weeks, the UN Habitat and World Health Organization have released a joint report integrating health in urban and territorial planning. It's a publication that couldn't come at a more appropriate time given the COVID-19 pandemic. A period in our planning, thinking and built environment history when we're needing to rethink some of our standards and approaches to things like urban design and public health within our towns, our cities and the buildings that comprise them. During the global response to the COVID pandemic, we've seen planning and health authorities working together to respond to the challenges that have been presented. History shows us that standards and approaches are frequently reshaped in the aftermath of these health challenges, and we can imagine there's more to come once the immediate shock of the pandemic has been addressed. We've looked at many of the challenges associated with overcrowding and conditions associated with informal settlements in previous episodes of the Talking Transformation podcast. However, health challenges associated with environmental health and living conditions are not limited only to the informal settlements. The report suggests that more than 12 million people lost their life in 2012 due to unhealthy living conditions globally, and air pollution is reckoned to have killed as many as 7 million people in 2016. The report also suggests that only 1 in 10 cities worldwide meet standards for healthy air. These are statistics that precede the COVID pandemic. The sourcebook is designed to guide decision makers from the public health, urban and planning sectors, the city managers, the health professional and others to focus on the urban planning and public health issues. It comes with a series of tips, some principles and approaches that it suggests will assist decision makers in thinking about the cities of the future. In today's episode, we'll find out exactly what is meant by territorial planning and the recommendations and principles that are embedded within the report. We talked to one of the report's principals and coordinators, Mexican architect Pamela Carbajal. Pamela works as an urban health and regional planning consultant at the UN Habitat's Human Settlements Programme. In addition to putting together this report and championing its contents, she's also supported different countries in Latin America on national urban policy development processes and targeted citywide public space assessments. We ask her to take us through the genesis of the report and how she hopes it will be received and used by the different role players. We're indebted to Pamela for spending the time and sharing her thoughts on the publication, and we invite you to share your thoughts on what she has to say via the Talking Transformation podcast messaging service that you can find on the Anchor podcast platform site, or use our Twitter handle via Talking Transfo and the number 1. Enjoy the episode. So it's a Sunday evening, it's just gone past 6 o'clock, and up in Nairobi in Kenya, I'm joined by Pamela Carbajal. Pamela is an architect by trade, originally from Mexico, but presently working with the UN Habitat out of their Nairobi offices in Kenya. Welcome, Pamela. Thank you so much for spending some time with us. How are you doing this evening?
Hi, thank you very much for having me. I'm very good, thanks, and I'm very happy to be here. Yes, as you said, I'm an architect by background. I am from the north of Mexico, Chihuahua. I studied in Mexico City, where I also worked as architect in the Public Space Authority in Mexico City. There we work on public spaces, design, strategy, and also maintaining them. And then from there, I moved to Nairobi, and right now I'm a consultant. I'm an urban health and regional planning consultant. I have been with UN Habitat for the last almost 3 years for now, and have been working in this area of urban health since then. I took part of these reports since it started. I had been providing technical review and content provision all along the way, as well as supporting on the coordination and all the minors of the report. I have been up to taking a lot of walks and working from home, trying to balance work and life.
How did you come to get involved with this project and ultimately the source book? What was the first that you learned of it, and what was it like to be involved in such a collaborative report, but B, something that is so important right now given our responses to COVID and other of the disease issues which are so prevalent here in the African continent and elsewhere in the world?
Yes, it has been an amazing experience coming from an architect background, jumping to a bit of urban work in Mexico City and then coming to a global scale. I started working more on urban and territorial planning at the beginning and then jumped to this big thematic area of urban health. My involvement in the project was a bit more of a personal interest, but as well as a need in the program. So it was a win-win.
Great opportunity, I'm sure.
Yes, yeah. And it has been a great experience, a very nice journey, because we can call the report as one of the outputs, but along the way we have had different interventions, small workshops here and there, and as well a lot of engagements with experts and city representatives on these thematics. So it has been a very rich experience, which I think that it's very well represented in the report.
Architects and planners have an interesting relationship in their professional and day-to-day environment. And it must have been a very interesting experience for you in working not only with planners around the world, but obviously what comes into the report is this strong emphasis and working relationship with the public health sector as well. That's one of the fundamentals. How did you find that experience of working with such a diverse group of different professionals and in different settings around the world?
I mean, I must say that it has been also a learning experience for me. I started working with the health sector as it wasn't my background before. So I think I have learned what also the report shows, that it's kind of the learnings and the challenges, which to start with is that we communicate very differently. We have two different languages. How do we bring them together has been one of the objectives of the report, bringing both agendas, bringing both languages, bringing both thematics to the same table. And it has been exactly what I have also experienced in my work along the development of this report.
Well, thanks very much for spending some of your time in sharing some of the content and the thinking that you've put into that documentation. You know, it obviously couldn't come at a more appropriate time, I guess. Here we are dealing with a global pandemic. The source book is quite clear that it's not just pandemics. There's a whole range of environmental and public health issues which are impacting on people's livelihoods across the world.
Yeah, of course. We have a long-lasting partnership with the World Health Organization and UN Habitat, working on urban health environments and so on. This particular work started right after the Habitat 3 conference in Quito, okay, where we had a joint event together and where we both had the New Urban Agenda published and the Health as a Pulse of the New Urban Agenda published. The Health as the Pulse of the New Urban Agenda point out the key elements that needed to incorporate health in the agenda. And one of these pillars is urban and territorial planning. Since then, we started working together on a series of different areas of work, and also this publication came as one of the outputs of this collaboration. So that is sort of a bit of the background. And yes, I agree with you that the source book couldn't came out in a better time. But as you said, we had work in these way before, even without knowing that the COVID-19 was going to come when we were going to release the publication. We started working fully in 2018 on this publication. Started with a big data research, which led to us a 600 plus resources we found out there. We categorized them, we filtered them, and now you can find 17 there in the publication. Along with the process, we also opened an open call for case studies. These case studies were also filtered and published on a compendium of inspiring practices, and were very instrumental as well in the development of the source book. You can find them in the publication feature along. Well, also to mention that UN Habitat and WHO has engaged with a very big group on urban health experts across the globe and from different regions and different backgrounds, from epidemiology to public health policies. And they have been quite instrumental on the development on the sourcebook as well, guiding in it.
And how did you find that linkage between your architectural background and then going into this public health environment? Did you find that there were advantages or disadvantages of the professional background going into that space?
Well, architecture is highly linked to urban development and to urban design and urban planning. And so in turn, as we have worked on this on urban health, I think it's all linked. And also architecture and health, I think it's very strong linked, for example, in housing codings or
the building regulations and so forth, right?
Yeah, no, I totally agree. Also, as well, we're now rethinking the density of our cities and the morphology of our cities, and I think architects will play a very key role on these decisions.
And ultimately, who was this report designed for? Who did the World Health Organization and UN Habitat want to read this report?
The report is mainly addressed for both planners and health professionals, which includes urban planners, city managers, and national governments, local governments, but as well it includes academia and civil societies. So as you're saying, yes, we're trying to cover all the stakeholders that are interested in urban development and that are willing to improve our environments for health and well-being. Well, yes, to better understand our links between the health and the planners, we have to go back in time to the Industrial Revolution. And as you're saying, then was a huge increase on urban dwellers, slums and congestions, and there was a big increase in diseases. And actually, the public health in the UK and in the States, the public health and the planners work very closely together to come up with new codes and new laws and regulations for the new urban developments that were coming up. So our relationship comes from back then, and over time, both sectors have been separating from each other. And we believe that now, and more now building from COVID, is the time to go back together and work among ourselves. Our urban environments are very complex, and as well, they touch on in any aspect of our urban health and well-being, right? So from communicable diseases to non-communicable diseases. Right now, as we're seeing COVID pandemic, it's a communicable disease, right? But it's also attacking people with non-communicable diseases.
So Pamela, I mean, right now, planners and health practitioners across the world are trying to get their heads around the COVID crisis. And we know social distancing and sanitation are fundamentals to addressing immediately that challenge, particularly whilst we're without a vaccine. But the report, I think, early on in the report, it talks to the other sort of diseases, both the communicable and the non-communicable diseases, which are so important. I'm thinking here of, within Africa, particularly things like the malaria. Malaria is a massive challenge for the African continent, but also things like respiratory illnesses, particularly where certain cities have got terrible air quality.
No, I totally agree. We're right now having our eyes on COVID-19, but we cannot forget all the other diseases that are arising together with COVID, or had been arising. As you say, malaria, it's a big thing in Africa, but as well, there are other non-communicable diseases that are arising together with COVID. So, for example, mental health problems, obesity, that this is a long-lasting and a lot of repercussions to our health in terms of diabetes or in terms of heart diseases. All of these diseases, from non-communicable to communicable diseases, can be prevented by focusing our attention on design and creation and management of our built and natural environment. And this is what the sourcebook is about. It's about bringing both actors together to better communicate and as well to better deliver in our cities.
It's really interesting in the document you talk, and it's called, it even mentions this thing of the idea of territorial planning. And I think it's really important for our listeners to try and understand what is meant by territorial planning. I'm assuming it's about the region or functional areas that go beyond a particular town or city limit. But let's hear it from somebody who's worked very closely on this concept.
What we mean by territorial, we mean going beyond the city and country limits. But as Habitat, we define urban and territorial planning as the process and the decision making that aiming at realizing the best of the urban environment through the development of goals and spatial visions and strategies and plans. It goes beyond country borders. So we could also see the example of regional corridors within a region of certain countries. So it goes beyond national level, I would say transnational level.
One of the things that we're seeing, Pamela, is that the impact of COVID is not equitable. And as always, it seems that the poor, the most marginalized of our communities, and those people living with comorbidities are the most vulnerable. How is it that these visions and the ideas of things like compaction, connectivity, social inclusion, resilient cities, all of these are words that we'll find in the report. How are they really trying to direct a more effective public health and quality of life for communities? So often planners are dismissed for using this language, but in this report it comes through very strongly that it's absolutely fundamental. And a lot of it is about getting the principles right. And then in the design, you can get the detail correct.
Yeah, and I totally agree with you on those principles that are, first of all, fundamental. So one of the aims of the report is to make the argument, and don't get it these means, as you're saying. So the report has this approach towards the end that it's called an entry point approach, which is also a support and making the argument and bringing it to action of these different concepts. So we all the time consider health as an entry point to urban planning, but then how do we consider urban health as an entry point to the urban and territorial planning? So yeah.
A lot of what the document talks about is this idea of partnership, the need for collaboration, not just between the planning and public health practitioners, but also around trying to link some of these difficult issues. There's a quote there which reads, "There needs to be a culture change within the planning profession and among decision makers and stakeholders. We need to build on the strengths of the planning tradition and to adapt to the complexity of accelerating global change by delivering at scale at a more rapid pace. Fiscal, taxation, governance, management and environmental regulation measures are not enough. They need to be supported by an integrative and nimble urban and territorial planning that is strategic, participatory, and based on human rights principles." Now, that's an extract from the report that I thought was quite powerful and had deep meaning. Your thoughts on some of these and the idea that it's a collaboration, it's the different decision makers working closely with the stakeholders and recognizing that it's not just the design, it's a much broader issues than that.
Yeah, addressing these issues through urban planning and design is not easy. Human settlements are nesting scales and complex in terms of resources, relationship, and in a constant state of change, as we're seeing now with the COVID-19, how cities are changing. So all of these add to the complexity, and this is kind of what the report is trying to break down in the different scenarios and with the different approaches. And it highlights that even though our urban environments and it are very complex, it is possible to influence the location of spatial planning and local designs using different approaches.
And in terms of the synergies or the linkages between the work and the efforts of planning and health, who are the participants that the report has identified as being the most able to drive the change?
Well, the report acknowledged that everyone has a role to play in this complex agenda, and everyone has a key component on developing healthy cities. We all need to take action in our different areas. The report targets primarily 4 participants, which are national governments, local authorities, civil society, and their organizations. and associations as well, and of course the professionals from health and urban. The report highlights the responsibilities and the powers they each of them have by themselves, but also collaborating among themselves. For example, it highlights that local community has an essential role in contributing knowledge and on-the-ground experience, which has a huge impact on the local buy-in.
Were you able to speak to a number of these, as you say, whether it's from a national point of view, some of the national government agencies, non-governmental organizations you might have worked with? Was this something that you were able to do in compiling the report?
Yeah, along the process, along the 2 years of compiling the report, we had also had the opportunity to deliver international workshops and as well some country workshops that were mainly focused on working together among the urban and health professionals and engaging in these type of activities has been very instrumental in the development of the sourcebook and as well shaping in it.
The report describes 4 dimensions of planning for health. Can you possibly just summarize those different 4 and give a sense which are important right now when cities are grappling with COVID-19? If I recall correctly, we're really talking about standards, about codes, frameworks, and ultimately processes on the ground.
Yes, of course. Well, just before explaining the 4 planning dimensions for health, I would like to highlight the 3 dimensions for the public health,
Fantastic.
Which are first health prevention, 2 is the health promotion and the curative dimension, and the 3rd one is sort of the ecological public health, which we can say. So the urban and territorial planning has the capacity to support these elements or these 3 dimensions that I mentioned through the 4 planning dimensions. We have already mentioned them along the talk. The first one that the report highlights is basic planning and legislative standards to avoid risk to health. The second one would be planning codes to limit environment that detract from health or exacerbate inequalities. And the third one will be a spatial framework to enable healthier lifestyle, for example, to provide citywide public spaces. And the 4th one is urban and territorial as a process to capture multiple benefits and building in health. For example, all the cross-sectoral approaches that as child-friendly initiatives.
Going beyond those 4 planning dimensions for health responses, the report also talks about assets, the idea that people are the most important and central to a response and should be supported by places and processes. It's almost like 3 Ps, I think, come up in the report.
Yeah, I like the idea of the 3 Ps. The report touches on these as an asset-based approach, which it places people at the center, places at the center, and process at the center. This approach is a long-use approach by the public health sector. So now we brought it to the urban sector. The first step of this approach is to identify existing assets. Instead of looking to the problems, is looking to the assets we have. The second step is to review and analyze how to better use of these assets for improvement. And also, this approach is very strong on empowering communities.
If we just took one step back and said, let's look to the future, let's look to 2025, let's hope that the world has found a way to deal with this pandemic and whatever else is thrown at it. But in terms of the report and the findings, the recommendations, the principles that are embedded within this source book, which of them do you think, if only 1 or 2 of them land in that time period, which of them would you really like to see as being the most important to you personally?
I would like to see, starting from now and being materialized in 5 years, I would like to see political commitment and leadership across all the actors in urban health. As well, I would like to see cities or countries sharing vision towards healthier environments, and to see planners being trained on how to do cross-sectoral approaches and how to integrate health into their different stages of planning or into their different planning mechanisms.
Those sound fantastic things to work towards. And when you mention that thing of leadership and in that political space, I suppose it's very easy to think about where we've seen a lack of leadership. But let's just, based on the work that you did and the people that you engaged with, are there any cities, any administrations that were particularly impressive to you that thought, this is the way people should be looking to this city or this country in terms of the way they're doing a particular theme within the report?
I better to say inspiring cases. And The report highlights a couple of inspiring cases. I could mention one right now from the UK, which is planning health weight environments. And then what they did is they managed to have both the health and the planners in the same table and work towards reducing obesity. It was that program. But then we have other inspiring cases featured in the report, but as well in the compendium of inspiring practices. And I think as the report highlights, it's not a matter of, there's no one way, there's no one straight line, but there are many different entry points and entries to improve our health and well-being as well. There are different ways of having the leadership and the commitment, right? So if I just might quote a bit of the report, Chapter 7 highlights these approaches and saying entry points, and it lets you a whole sort of a scenario to work towards improving these urban environments by setting, by outcome, by principle, or by sector. And all of these lines are quite important. And all of these lines, it doesn't matter if you're working by sector, but at the same time, there are some other by setting or so. So I think all of them complement to each other. So I would not like to just mention one area, but I think the overall network, it's the powerful towards the better urban health environments.
One of the things that we were obviously very happy to see in there was that the Western Cape is included. And I think there the violence prevention through urban upgrading program, or the VPUU, features prominently in the document. Can you maybe explain why that was an important case study that you had wanted to include in the publication?
Yeah, of course. I think it's such an interesting case study. So just to give a bit of background, this case study was submitted by the Violence Prevention Through Urban Upgrading in 2018 in response to our open call. And the case study was also published in the Compendium of Inspiring Practices. We find it very interesting, this case study, because it has a holistic approach to upgrade the neighborhoods and informal settlements. And it has the initiative has been able to raise the voice of the communities and reach these voices to the decision-making process and engage them with the local authorities.
Chapter 8 in the document is I found particularly useful, very practical. It looks at analytical tools to support different scenarios and different planning techniques. Which do you think, when you look back on this, Pamela, will be most of interest to built environment practitioners who may well be listening?
Yeah, this is a very good question. The section outlines different analytical tools. I think the interest of the tools, it all depends on the scenario you are and in the context and the specific context and the needs that are required. But I will say, for example, for this period of time that we're passing through with the COVID, I think the cumulative risk and comparative risk assessments are very useful techniques which support us to deal with complexity and give us an overview on risks. And I think that is one of the key elements that we need to start focus on learning from this experience that all cities are having during COVID-19 pandemic.
So, I mean, where can people find out more about the report? How can they engage with you, Pamela, about the findings, the recommendations, and ultimately where it's landing? I'm guessing it's still quite early days for the report. I think it's only come out the last few weeks. How are you communicating it? How are you making sure it has a voice or it has a presence? When I say everyone's mind seems to be focused on the pandemic at hand, how is it going and where to from here?
One of the ways we're trying to reach out is actually like these kind of conversations. So I'm very thankful for being here with you. We have been reaching out through our country offices, together with WHO and UN Habitat, as well through partners. And we have been seeing very good feedback and very good reaction towards the publication. And from now on, we're starting to building the way forward and the next steps, as you're saying. We have been engaged with several different organizations which are quite interested on taking it forward. So we're in that stage right now. They can subscribe to our mailing list that we send a newsletter every 2-3 months. And it's a good way to maintain inform us. We can put the email here.
Fantastic. Well, the email address that we have here, just to make sure it's correct, is UN-Habitat and then a -IG-UTP@un.org. Is that correct?
Yes.
Then Pamela, many thanks for spending some time with us and explaining what I think is a very useful report. As I couldn't come at a more opportune time, needs to be part of the thinking, is very well aligned to the strategic or rather the sustainable development goals, so highly topical and relevant in respect of that agenda. And I really do wish you and the UN Habitat, the World Health Organization, the very best in promoting the content, and good luck. Hopefully we get a chance to talk in the coming few months about the response that you've got, about where the report has landed and what you've achieved with it. So hopefully this is not the last conversation that we have.
Thanks, Pete, for having me. It has been such a nice evening and also a pleasure to be here with you.
All the very, very best. Good luck to you and the UN Habitat team. Be safe, and all the very best up there in Nairobi, Kenya.
Thank you. All the very best to you as well.
We hope you enjoyed this episode of the Talking Transformation podcast. Please engage with us and let us know your thoughts on this episode. You can do so via the Anchor podcast platform. There's a voice message function available via the app. You can also follow us on Twitter via Talking Transfo and the number 1. So Talking Transfo 1. Our theme music is kindly made available by Tribal Need. Find out about the music, the street art shows here in Cape Town and Europe via tribalneed.com.